Okay, so now for some choking prevention and then also infant CPR, all right? First off the bat, the risk of danger and choking really starts to increase when your baby starts eating solid food, all right? Now that changes, that's different for every baby. Usually in the birthing world and babies, they start getting introduced to solid foods around 6 months, okay? However, every baby is different. I mean, look, my oldest brother had two teeth, okay? At 2 months, and my mom, is feeding him lamb chops, okay? This is, 45 years ago. I don't know, so I don't know if that's going to happen now. However, I'm just saying, your baby's going to start eating solid foods and you guys are going to introduce them typically around 6 months. And then the risk of choking goes up, right? Because we're introducing solid foods, whereas until then, it's mostly either breast milk or formula, all right? And, when you start introducing them, that's another story, although, you start with the little cereals, oatmeal, rice cereal, those little cereals mixed with formula or breast milk, and then it moves into vegetables, and then it moves into fruit like that. Usually we're introducing fruit after, because if you introduce fruit first, they don't want anything else because it's nice and sweet. And then it comes into, the proteins and, however else you introduce your kid's diet, okay? All right, so the risk of choking goes up when we introduce solid food and also when they start crawling around, right? So when they're sitting still, there's not so much risk of them choking. And when they do start crawling around and exploring, right, which starts in, month 2, 3, 4, they're starting to, creep and then start to crawl. It's different for every baby. Although the first month or two, they're not moving so much. However, right after then, and again, every baby's different, they start to creep and crawl and start moving around. All right. And when that happens, you want to consider getting on your hands and knees, crawling around, checking things about. Okay, a few off the bat. We're gonna talk about a whole section of safety and baby proofing in the second class in birth management. All right, and bringing the baby home after the birth. However, off the bat, door stops, the little springy door stops that are at the bottom, major choking hazard, okay? They crawl around, those things are right at their eye level. They have a little plastic cap. They love those, okay? It's your first kid, so, there's not so many Barbie shoes and Lego pieces laying around. However, a penny, from the couch, or a coin from between the couch cushions, a pen cap under the couch. Another thing that you might want to avoid because we're not used to it is plugging your cell phone charger up higher, right? Because if it's lower and dangling and they find that thing, a little 110, we want to avoid that as well. So those are some basics you want to get started with to start, the baby proofing process. You can use a toilet paper tube, and if something's going to go down there, for sure, they could choke on it, all right? So the risk goes up as your kid, clearly they start moving around and you introduce solid foods, okay? So now, let's talk about the first thing I want to share with you is a choking prevention technique, and this is not, I repeat, not an American Red Cross movement, okay? This is not an American Red Cross technique. This is a Nogan technique. And we've used this technique through our 4 kids at least a dozen times. 4 kids through the, infancy, toddler, the whole business. Very effective, okay? I've never personally dealt with a true blue choking infant, all right? And a lot of it is because we use this technique, all right? So this Nogan technique is, I call it recognizing the uh-oh face, okay? The uh-oh face technique. And look, there's going to be a point, your baby's going to be sitting up, they're in their high chair, right? We're introducing solid food already, and, they're sitting there, and what's going to happen is something similar. The same thing that happens to adults sometimes is that a piece of food goes in, and they're not quite choking. It didn't quite go down the wrong pipe, but it's like a, you know what I'm talking about? Where everyone's like, are you okay? You okay? And you're like, okay, I'm all right. You know what I'm talking about? Okay. Same thing happens with the kid. So let's just say they're in the high chair and you recognize the uh-oh face. This is how this little technique works. You recognize the face, and this is what you do. You're going to pick them up and turn them upside down. That's it, okay? Very simple, right? Keep it simple. You turn them upside down, and then every time we did this and we caught the face, whatever they were about to choke on fell out. It just worked. Okay, now we recognized it, we flipped them up, and look, I'm not talking about spinning your baby around or doing anything crazy, okay? And yes, being conscious of their head and neck, right? We pick them up, flip them upside down, and one of us would look in the mouth, okay? Now, sometimes, what if the mouth is closed? Squeeze the cheeks, it'll open their mouth, and take a look inside. All right, you will never do a blind finger sweep on an infant, okay? Never. And this goes for CPR as well, all right? Any choking prevention, choking procedure, you're never going to stick your finger in blindly into your infant's mouth for a number of reasons. Number one, you can push an object further down their throat. You could damage the inside structures, right? You can affect the palate and all of that. It's not something that you want to do. Now, if you do this procedure, you see them, you pick them up, you flip them upside down, you open their mouth, you see something in there, then yeah, okay, fish it out, all right? However, you're not just going to stick your finger in their mouth blindly. Okay, that is the Nogan choking prevention technique that's worked at least a dozen times, okay? For real. Okay, so now let's talk about if we miss the uh-oh face, or it was a different circumstance altogether, and you're out and about, or they put something in their mouth and you reckon they're choking, okay? So how do you identify if your child, your infant, your child, really anybody is actually choking? They're not going to be making any sound. Okay? An adult, a child, an infant, no sound, no crying, no coughing, nothing. Okay? If nothing is coming out, they're choking. If they're making a sound, if they're crying, they are not choking. Okay? So let's just say they are indeed choking. I'm about to show you the actual American Red Cross infant choking procedure, which I do know from colleagues, other CPR instructors, who have indeed had a true blue choking infant, and this is very, very, very effective in dislodging the object if you do it correctly, okay? And you're about to learn how to do that. All right, you recognize your kid is choking, all right? First and foremost, 911, okay? Always error on the side of caution, okay? If it's in your capability, you're alone, then I get right to the thing, right to the procedure. If you're not, honey, call 911. Unless you want to pick up your phone, call 911. However, your adrenaline's going to start pumping. You're going to start freaking out a little bit. Again, if you can control yourself, ultimately practice of these techniques are going to make them more accessible to you. If you talk to any emergency response personnel, emergency room doctor, these folks rely on training, because even EMS people, they walk into an emergency situation, Yeah, they're more centered, although their adrenaline starts going. They're human. We're human beings. It's what happens in an emergency. Our adrenaline starts flipping out. So we rely on the training, okay? So this is what you're going to want to do. You recognize your kid is choking, 911, you get right to it, okay? So this is what you're going to do. You're going to cup your hand just like this, and you're going to cup your baby's jaw. You're going to hold their jaw. Again, infant management. You're managing this task, okay? You're going to hold them by their jaw like this, and you want to be sure that you leave their mouth open. We don't want to cover their mouth because whatever object that they're choking on, we want to have ejected, okay? So now, I'm going to stand up here for you. You have them just like this. You're going to use gravity, and they're going to be right here on your leg, okay? You can do this sitting, and you can put your leg out the same way. You're going to want to use gravity here, okay? And then you're going to give 5 back blows, okay? 1, 2, 3, 4, 5. Right here in the center of their shoulder blades, okay? And also, the back blows, you're not hitting them flat like this on their back. At an angle, the blow is down into the floor, right? So it's down and away, down and away, down and away, like this, okay? You're not hitting them flat on the back, down and away, with this part of your hand, okay? Like that. Okay, so we have Junior here. We got him tucked here on the leg. We're feeling they're secure here on the leg at an angle about 45 degrees, supported on your leg, 5 back blows. 1, 2, 3, 4, 5. Okay, then you're going to take them by the back of their head like this. You still have them sandwiched like this. They're going to come to the other side. Right now they're on the other leg. 5 chest compressions. Vertically, just like this, between the nipples, right in the center of the chest. Okay, like this, 5 chest compressions. 1, 2, 3, 4, 5. Then you're going to take them by the jaw again, back over. Okay, back over. 1, 2, 3, 4, 5. Back to chest compressions. 1, 2, 3, 4, 5. You're going to continue back blows and chest compressions until one of 2 things happen. Okay? 1, 2, 3, 4. One of 2 things are going to happen. Number 1 is your baby will spit up whatever they were choking on, which is the best case scenario. So you're going to keep doing the back blows, chest compressions, till one of 2 things happen. Number 1 is they spit out the object and they start to cry, and air comes in and you're done. You saved the day, okay? Hooray! Yay! Woo! Like that. Or, unfortunately, the other thing that could happen is that your baby will go unconscious, okay? Because, again, unfortunately, when a human being can't breathe, they go unconscious, in which case you would start CPR immediately, okay? So, let's say that's case number 2 and your baby goes unconscious. You're going to start CPR immediately. If you did not have 911 on the phone, you're going to get them on the phone now, big time, okay? You want 911 on the way. So 911 is on the way. You're going to start CPR. CPR for an infant and also for an adult, okay? Except it's the power of the breath is going to be 2 puffs to 30 compressions. So for an adult, it's a full breath, like a but for a baby, for your infant, it's a puff, like that, a puff of air, okay? And it's 2 puffs to 30 compressions, and a few things. First, you want to be on a hard surface, okay? No bed, no footstool. You want to be either on a table, on the ground, someplace strong because you need to do compressions and there needs to be resistance so you can compress their chest down. Okay, so you're on a hard surface, and when you put your mouth on the baby, you want to put your mouth over their nose and their mouth. You're going to suction your mouth over their nose and the mouth, okay, like this. Like that, all right? Because their mouth, it's too small for you just to do their little mouth. So you're going to put your mouth over their nose and mouth. 2 puffs, okay? To 30 compressions, okay? Now, you could put your fingers straight down. And again, when we're doing chest compressions, we want to be right in the center, vertically like this, okay? Not horizontally. We want to be right in the center. And the reason is we have a bone right in the center here, and the ribs all attach, okay? So we want to be right over the heart, pressing down on this bone. And 30 compressions. So you could use your fingers, or you could bend your knuckles like this. You know, women, again, you know, if they have fingernails, it might not be comfortable. You could bend your knuckles like this, and you do 30 compressions. 1, 2. You might want to be standing, okay, because it can get tiring. Your adrenaline is going. So 1 and 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 2 puffs, 30 compressions. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 29, 30. Okay, the compressions are pretty fast. Their heart's beating at least 120 beats per minute, and it's going pretty quick. Now, a couple of key things, all right? You know, when I'm teaching CPR, I think it's important to recognize that we're not EMTs, and it's like, what is the main things for me to remember in case of an emergency, right? That's the main thing I want to come across, right? So the first thing is 2 puffs, 30 compressions. The next thing is you never want to lose contact, right? So when you're doing compressions, you want to keep your contact with the baby, with your patient, okay? With the patient. And also the depth of the compression. A lot of people don't make it because we don't realize we really need to compress the chest to compress the heart, okay? So there's 2 things here. Number 1, you want to make sure the depth, you're going down by the books, it's about 1.5 inches of depth, okay? So you want to make sure you really compress the chest. And then also at the same time, you want to make sure you let the chest come all the way up. Because as you compress the chest, boom, right? You're squeezing the heart, boom, to pump it. It's going to fill back up with blood. We want to compress it and then let it fill back up so it can pump the blood and the oxygen around. So if you compress it, but you don't let it go all the way up, it's not doing anything, okay? So you want to make sure you keep contact and that you go all the way down and all the way up, down, up, and let the chest fully open and close. A lot of adults die this way. You know, they go down for a heart attack and someone's, you know, a good Samaritan, or a lot of times wives, right? A lot of dudes go down and they call the ambulance and the wife goes and they're not really need to compress, especially with an adult, okay? To compress the heart, boom, 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 okay? All right. So those really are the main factors involved here. That's infant CPR. 2 puffs to 30 compressions, okay? Making sure your compression goes all the way down, all the way up until help arrives. And one thing I wanted to just kind of tie back around that I like to mention, and is a very common question, is when we're doing the choking, right? And I'm giving back blows, and people are like, well, you know, you're hitting them pretty hard there, you know? Listen, again, you know, we're talking about serious adrenaline and your kid, you know, potentially dying and choking, okay? There's going to be a lot of adrenaline. And I want to share with you most kids, we're talking about a broken rib here, right? So first, my perspective is, I'd rather have a broken rib than a dead kid for sure, okay? So I'm not gonna freak out about exactly how much pressure I'm using here. And also, babies don't typically get broken ribs, right? Because they're mostly cartilage. And again, I'm just trying to decrease your amount of anxiety about things like this when it's more for you to recognize what to do in case of the emergency, and then things are going to unfold as they should, right? You're doing it, you get the baby, you recognize they're choking, you're giving them the back blows, you're doing the chest compressions. That's the main thing, okay, is getting the job done. You're not going to be able to fully, look, you're not going to, be under duress, 5 back blows, okay? You're going to use, the force that you feel is right at that time. Your body's going to know 1, 2, 3, 4, 5. Do the procedure, okay? You get into a jam, your body's going to take over, okay? 5 back blows, 5 chest compressions, 5 back blows, 5 chest compressions. CPR, okay? 2 puffs, 30 compressions. Make sure you're compressing the chest. Don't take your fingers off. Now I want to cover with you one last piece that's tied in with CPR, and that is using an AED device, an automatic electric defibrillator, okay? Looks like this. These devices are amazing, okay, for real. And they are very common now, out and about, out in the world. And the main thing for you to recognize to be successful using an AED device is to turn it on. So let's say you're out, okay, you took your eyes off your kid for a second. Whatever the circumstance, maybe they were choking, they found something, they choked on it, they're unconscious, and you're in CPR, right? You tried the back blows, nothing worked. You're doing CPR, okay? And then out of the corner of your eye, you see one of these AED devices, right? And you're like, get me the thing, get me the device thing, bring it over here, okay? Help me, come on, somebody. So you're here doing the compressions and the breath, the 2 puffs to 30 compressions. You see the thing, someone brings it over, okay? You take the thing off, okay? And the main thing here, turn it on. Turn it on, okay? You turn it on and it's gonna say, put pads on patient, put pads on patient. These machines walk you through what to do, okay? Now, an AED device works when somebody's in cardiac arrest, okay? Cardiac arrest is an electrical problem, okay? A heart attack is a plumbing problem. Like in grown-ups, if you're out and about and a grown-up hits the ground and they are typically in cardiac arrest, and most of the time, it may be caused by a plumbing problem, although cardiac arrest in itself is an electrical issue, okay? And this helps to solve the electrical problem, okay? So in this case, okay, your baby's out, and we want to use this thing in case it's going to help to revitalize them, okay? Now, out and about in the world, most of the time, the pads are made for adults, okay? They do make children-size pads, and they're just expensive. Like things are expensive. And you think about a big chain that's putting these devices in their place, it's even more. So they put in the big pads most of the time, okay? So you're doing CPR, they bring the thing over, okay? And just so you know, most of the time, if someone pulls the device out of the container on the wall, it's going to signal for help. So whether you called 911 or not at this point, you pull the device off the wall, most times, in most circumstances, there's a signal to emergency services. Okay? So now you get the thing, you turn it on, it says put pads on patient, you got these big pads, you take the outfit off for your kid, okay? And then what you're gonna do is you're gonna put one pad on the back and one pad on the front, just like this. Okay, doesn't need to look pretty. You get those pads on the kid like this, front and back, because it needs to make a circuit, okay? It needs to close the circuit. So now it's going to say, scanning patient, and it's going to tell you what to do. It's going to say, continue CPR, so you continue CPR. 2 puffs, 30 compressions, 2 puffs, 30 compressions. And then it's going to rescan the patient like every minute or so, okay? Rescanning, scanning patient, and then it might say to you, okay, stand back, delivering a pulse. Now there's really 2 kinds. More and more, these machines are fully animated, okay? Meaning, if it determines the patient needs a pulse, it will say, stand back, delivering pulse, and you need to get your hands off. And I know, again, I only wish you're never in this circumstance, although your adrenaline would be pumping, you'd be freaking out. Even still, do not touch your kid, okay? Do not. Or whoever that you have this hooked up to, because it can very easily throw your heart out of rhythm. For real, okay? So it says delivering pulse, stand back. You let it deliver the pulse. Excuse me. Okay, so it's scanning patient. So again, 2 kinds. One will say delivering pulse, stand back, and the other kind are still manual, and they'll you need to deliver the pulse. Press, deliver, pulse. And there's a button where you need to press, and you're gonna stand back and you're gonna press that button when it tells you to press the button, okay? That's how this thing operates. Those 2 ways. And again, more and more, it does it for you, although you may be in a circumstance where you need to press the button, okay? So it is amazing. Scanning patient, continue CPR, or delivering pulse, or you deliver the pulse, and that's what you do. These are amazing devices. If you're in the unfortunate circumstance where you have to deliver these skills and you do see one, and your consciousness allows for it, right? Get it, turn it on, and it can very likely help you to save the day. Okay, very amazing. All right. So, here we are, my friend. I sincerely hope that you are feeling more empowered and more grounded, and really, I feel like I could hand you an infant and you have an idea what to do. Check the diaper first, clean that diaper, change the diaper. Oh, hey, to whoever the mom is, okay? Maybe your wife. I'm just saying, you could manage any infant that somebody hands to you. You know how to feed them, how to burp them, okay? How to determine how long things take. You know how to support your woman through breastfeeding, engorgement, infant CPR, you have choking prevention, you got some centering skills. I really hope you're feeling, even at this point, more confident and more empowered, because you truly, for real, are more prepared right now than most people walking around to manage their infant. And I think that's awesome. I'm hoping you're feeling that way. And now, as we conclude session 1, which was infant management skills, I'm super excited to roll into with you birth management, which is going to set you up like crazy to be a hero dad, knowing pre-birth skills that you're going to be able to put into play right away, and then move through the birth, and then also through postpartum. Super excited to get there with you, and coming up.